This is a chronic condition in which there are numerous physical complaints. These complaints can last for years and result in substantial impairment. In the DSM-5, the condition has been renamed Somatic Symptom Disorder, SSD. There are significant departures from the DSM-IV categorization, which identified somatization disorder, pain disorder, and undifferentiated somatoform disorder, which identified somatization disorder, pain disorder, and undifferentiated somatoform disorder. All these are now included under the heading of SSD. Another innovation is that the symptoms need no longer to be medically unexplained, but may or may not be associated with another medical condition. Thus, patients who had organic comorbidities such as heart diseases or cancer who were previously excluded under DSM-IV can now be included in the diagnosis of SSD and be considered for appropriate treatment. SSD can be associated with a great deal of stigma. There is a risk that patients may be dismissed by their physicians as having problems that are all in their head. However, as researchers study the connections between the brain, the digestive system, and the immune system, SSD is becoming better understood. It should not be seen as a malnourished condition that the patients can control.
Well, the main diagnostic criteria or the briefly diagnostic criteria in somatic symptoms that the patient experience some sort of impairment in his way of thinking or thoughts impairment concerning his health. Interesting. And the patient found himself with a lot of concern and focusing in his
For the prevalence of this disorder is estimated to be 0.2%, and usually the female to male ratio is considered to be 5:1. So it's more prevalent among females.
Somatic symptoms in general population may be around 5% to 7%. Females tend to report some somatic disorder or some somatic symptoms disorder more than males.
For the gender-related diagnostic issues, as it's known, female to male ratio is considered to be around 5:1. So the condition is more prevalent among females.
The disorder is associated with marked impairment of health states. Many individuals with severe somatic symptom disorder are likely to have impaired health states. Scores more than 2 standard deviation below population norms. And this is important, significant results that may refers to the relationship between the impairment of health states and how much the patient started to focusing about his health states and induce somatic symptom disorder.
Somatization disorder is defined as a chronic condition of multiple medically unexplained symptoms. Such kind of symptoms may, for the first look, appear to be due to neurological disturbance. But when we dig in depth for the diagnosis, we find psychological disturbances, and such psychological disturbances are used to define the condition. The functional impairment, the impairment in the life of the client, the consequences on patients and their caregivers, the consequences on the daily life of patients are very troublesome. And usually clients seek medical attention for the evaluation of such kind of medically unexplained symptomatology.
Recent research has shown higher percentages of this disorder in people with irritable bowel syndrome and in chronic pain patients. A high proportion of patients with post-traumatic stress disorder also suffer from somatization. Antisocial personality disorder is associated with a risk for SSD. The somatizing patient seems to seek the sick rule, which affords relief from stressful or impossible interpersonal expectations. In most societies, this provides attention, caring, and sometimes even monetary reward. This is not malingering because the patient is not aware of the process through which the symptoms arise, cannot will them away, and genuinely suffers from the symptoms. Several studies have suggested an association between somatization and a history of sexual or physical abuse in a significant proportion of patients. One study reported that patients with somatization syndromes were often associated with the interpersonal representation of the unmet need for closeness with others. Another study suggested that neuroendocrine genes may be implicated.
One of the most important about risk and prognostic factors that the neuroticism of personality traits may induce some sort of somatic symptoms disorder. Another important thing related to the environmental, the patient or the people with few years of educations and low socioeconomic level may present some sort of somatic symptoms, and the another side related to the females, as we said before, and in older age in females may presented somatic symptoms in comparison with male.
The causes of somatization disorder usually include childhood traumas, childhood sexual abuse, the parental over-concern about the illnesses which occur during childhood is considered to be an important cause for somatization disorder.
In the somatic symptom disorder, there is a consistent relationship between somatic symptom disorder and another medical or psychological disorder. Perhaps we found some sort of differential diagnosis may occur or may make a disturbance to identify somatic symptom disorder. One of most important is other medical condition and the panic disorder, generalized anxiety disorder, as we said or described in previous episodes, and depressive disorder, and the conversion disorder with delusion disorder also. So all of this we have to make a differential diagnosis, a wild differential diagnosis actually between the somatic symptom disorder and all this kind of disorders. Somatic symptoms disorder is associated with a high rates of medical conditions and medical disorder, as well as depression and anxiety disorder.
Symptoms. Some of the numerous symptoms that can occur with somatization disorder include cardiac, shortness of breath or chest pain, gastrointestinal, abdominal pain, difficulty swallowing, nausea, bloating, musculoskeletal, pain in the legs or arms, back pain, joint pain, neurological, headaches, amnesia, vision changes, weakness, urogenital, pain during urination, impotence, irregular menstruation.
The most important in the diagnostic criteria in somatic symptoms that the patient have some sort of negative thoughts toward his health. Another important thing, that he presented a high level of anxiety. Another important thing, that he present or spend a lot of time or energy to make health investigation about himself. Important issue in the criteria or the diagnostic criteria in somatic symptoms, that the patient have a lot of interesting about any changes in his health or any changes in his body.
Some people, when they have a stress, his psyche didn't tolerate that stress. For that reason, he would try to pull the body, if we can say, and please help me in dealing with this stress or these symptoms which I couldn't tolerate as a psyche or as a self, not the body part. Please could help me for some time. For that reason, sometimes we have the somatic symptomatology in the patients. Sometimes no. With the psychiatric disorder, there's some mild physical or somatic symptoms, but the patient have anxious personality, then his explanation, the magnified explanation of that presentation, make the somatic symptoms increase gradually with time. Then he may go and look for physical reasons, physical management, not for the psychological one, especially if the patient have a very high stigma about the psychiatric disorders.
Somatic symptoms, it's some sort of delusion or hypochondriasis. What does it mean? Hypochondriasis, it means that the patient has some sort of negative false beliefs that he's suffering from a somatic problem or organic disease. We found a lot of patients, females, came to the clinic and say that they think that they have breast cancer, and after the laboratory testing, the result was unremarkable. So that we can find that the patient from time to another started to feel that they suffering from somatic disorders or somatic delusion, or that there is impairment in some sort of organic functions or biological functions.
Somatic disorder, formerly known as a somatoform disorder, is a mental disorder characterized by symptoms that suggest physical illness, and the patients complaining from a somatic disorder preoccupied with somatic pain, somatic illness, and increased level of worry or anxiety about this symptoms. And these symptoms or this disturbance leads to disturbance, impairment, or distress in social and occupational function.
Most patients who suffering from somatic disorders coming to the clinic by several complaints, over asking for medication without any previous reason. You may find that he always feel of fatigue or feeling of uncomfortable and feeling of pain in different areas in his body or her bodies.
Somatic disorder can be classified into somatic type and illness and anxiety type and unspecified type. Somatic type, one or more or recurrent symptoms or repetitive recurrent symptoms that the patient complaining from this, and these symptoms worry about from these patients and fear from these patients and increase level of anxiety about these symptoms. These symptoms disturb and distress in their life and distress in occupational functioning, not due to other psychological or pathological or due to induced or medication induced this somatic type. The most common somatic type is pain somatic type, the most common type.
Patient who's suffering from somatic symptoms may has some deterioration in his communication with people around him. He cannot continue in a relationship. He cannot even building a friendship with people around him. He always compares himself by people around him and always has feeling of selfishness about himself, that he has to make a perfectionism in his bodies and he has to walking through the idealization of health and the idealization of bodybuilding, regardless any other condition around him, regardless that this make a distress about people around him.
For the differential diagnosis, neurological disorders as well as other psychiatric disorders should almost always be ruled out when we speak about somatization disorders.
Most of the patients who suffering from somatic symptoms may induce some sort of feeling a common or significant pain. Patient also who suffering from somatic symptoms may also induce a depression or feeling of mood disturbance. About the somatic symptoms, patient also may present a disruption of daily life.
Treatment. A better goal is to help the patient succeed in coping with the symptoms. Treatment is successful if it keeps the patient out of the hospital. General advice: the whole primary care health team should be aware of the diagnosis and management plan. This will make the approach to management consistent across the practice. Interventions directed at reducing specific sources of stress are most helpful. These may include advice about dealing with marital conflict. Some physical exercise is important and it prevents loss of fitness, enhances self-esteem, and provides an opportunity for patients to take a break from oppressive duties and unpleasant situations. From oppressive duties or unpleasant situations. One study reported a reduction in symptoms with low-grade short bouts of exercise. The importance of pleasurable private time should be emphasized. This may include yoga classes or meditation, bowling or nature walks, which under the general title of stress management can be presented as necessary medical treatments. Some patients may request tests repeatedly, but they should be reminded that they will be followed with frequent and regular visits so that any problems will be identified early. Sometimes requesting investigations becomes a negotiating process designed to give the patient some control over what test is performed and to enhance the trust level between the physician and the patient. Psychotherapy. Approaches derived from cognitive behavioral therapy have been shown to reduce the intensity and frequency of somatic complaints and to improve functioning in many somatizing patients. This type of treatment starts with the mutual agreement that whatever the patient has been thinking and doing about the condition has not been successful. It then begins to challenge the patient's beliefs and maladaptive behaviors in a recurring manner. Short course intervention therapy, 8 to 16 sessions, specifically for treatment of somatizing patients, has been shown to be remarkably effective in improving function and reducing the stress. The sessions combine general advice such as stress management, problem solving, and training in social skills with specific intervention targeted at the amplification and need to be sick features of somatization. Pharmacological. There are psychiatric disorders associated with somatization, specifically anxiety and depression. These respond well to treatment, but especially with antidepressants, it's important to start with low doses and to increase them progressively to avoid side effects that may be present at the beginning of treatment and which might discourage the patient from continuing. One study reporting the successful use of duloxetine. One study reported the successful use of duloxetine.
For the drug treatment, usually we use antidepressants. Selective serotonin reuptake inhibitors are considered to be a good choice in managing clients with somatization disorder.